Let's start with the knife fight that's going on in D.C. right now. Let's just go right there. So maybe you could kind of elaborate on, like, Trump's elected, he's trying to gut the Affordable Care Act. There's so much noise around this. Maybe you could just tell us a little bit about what's going on in D.C. right now.
Sure, yeah. Thanks, Jordan. I think there's a couple of dynamics, and you're all observing most of them, so not all this will be news. But I think, one of them is clearly the drop-off between the rhetoric of campaign versus the reality of governing, which may be equivalent to the hype of raising money versus actually having to operate a startup. And I think it was all well and good, I think, during a campaign season and even for the Republican Congress to be critical of the ACA. It was an effective talking point. One could argue we at the Obama administration didn't do a good enough job telling people why it mattered, why the ACA mattered to them, the protections, not just the coverage gains, but how this improved their lives. But nevertheless, I think once the Republicans won, it became fairly clear that just casting aspersions wasn't good enough. It's actually harder to actually do things than to criticize. And there's an adage, there's probably a dozen adages that say that. So one of the dynamics going on is now I think you're really seeing the new administration and, more importantly, the new Congress struggle to figure out what to do and how to carry things forward. It's not just a policy struggle. It's also a money struggle, as all things are. To put a fine point on this, if they repeal the ACA in the fashion that they originally talked about, which is repeal it now, pass a new plan later, not only do you have to come up with new policies in a bipartisan fashion, which is hard enough, but they would essentially take all the money that supports the ACA, because the ACA paid for itself, and then some, and they pass it back in a tax break to high earners. And so in order to get another plan, they would have to raise a whole other set of money to pay for it. And that's, in this day and age in Washington, you're talking trillions of dollars that's very unlikely to happen. So I think what you've seen more recently over the last few weeks in this knife fight is very centrist folks, Republican governors, Republican senators, actuaries, insurance companies, hospitals, saying, hey, wait a minute, this isn't what you campaigned on. You campaigned on repeal and replace, which implied to all of us you're going to give us something better. You didn't campaign on you're going to get rid of this thing and then
figure it out later,
put a gun to our heads, and so forth. And I think people are speaking pretty loudly and saying that's not good enough. So there's a scramble.
And so to put a fine point on that for a second is, if they repeal this and they don't replace it and they wait, all that money that was going to fund hospitals and care for people, if that goes away, is that not a job killer? I mean, these hospital systems employ a lot of people, and with all that money, I mean, how does one square we're going to repeal this, and oh, by the way, we're going to kill lots of jobs? Because healthcare is a big job generator.
You're absolutely right, Jordan. Even uncertainty is a job killer, because we just saw the January numbers, and there was a 50% reduction in hiring in hospitals in January. I've been taking an informal poll of hospital CEOs. 40% of them told me that they are reducing hiring this year. 30% told me they're reducing capital projects and budgets, and about 35% have said that they're going to put a halt to their strategic initiatives just because of uncertainty. And I just talked to a bunch of software companies over the last couple of days since I've been in San Francisco, and they've all said they felt it. They're all beginning to feel decision-making grind to a halt. So this is what happens when you get to a place where you have you induce massive amount of uncertainty about how things are going to go forward, and boards don't do well with uncertainty. If Medicaid expansion goes away, for most hospital systems, their bad debt will double or triple, and most hospital systems are not going to plan and spend in the meantime.